Two videos before doing this, we spoke about what? Thoracentesis. Now, here talking about what? Pericardiocentesis. Anytime you hear synthesis in medicine, just so that they are trying to talk about what? There's a fluid accumulation that you are trying to access this fluid, maybe for diagnostic purposes, or you are trying to access this fluid for therapeutic purposes. That means what? You want to drain out the fluid. All right. So when they talk about pericardiocentesis, where do you suspect is the region or the location where they are trying to drain the fluid? Of course, it's the pericardium, which is a sac surrounding the heart. Alright. So by the way, guys, this is the 4,500th video on this YouTube channel. Alright. So talk about pericardiocentesis. So pericardiocentesis is simply like, okay, there's accumulation of fluid in the pericardium, the sac surrounding the heart. So you want to access this fluid, alright? And there could be different reasons for doing this, which is into what? Diagnostics or therapeutic, alright? So let's talk about this. We said that pericardiocentesis is a medical procedure that involves inserting a needle into the pericardial sac to remove fluid or blood that has accumulated around the heart. So can you see that what? There's fluid buildup. Alright, this is like taking a small portion of this. There's a fluid buildup around the heart here. Fluid buildup. Alright, so now you want to now put a needle. So you have to be careful so that the needle should not pass this side, then through the person's heart. Alright, you have to be very, very careful. Right? Indications: why will you be doing this type of procedure? If the patient is having cardiac tamponade, alright, there's something compressing the heart. You have to just what? Do this surgery so that you can, if you are doing it for diagnosis now, you are trying to know the fluid, or you are doing it for therapeutic now, you are trying to now extract the fluid so that the patient will have some rest. Okay. Then pericardial effusion too is fluid accumulation, trauma or injury to the heart or pericardium, malignant pericardial effusion, which is a pericardial effusion that is cancer related. Then purulent or pericarditis, where you're having an infected fluid. So the fluid around the heart now is actually pus, right? Right? Procedure. You can do it with echocardiogram guidance. Then, okay, as you are inserting the needle, you are watching it on an echocardiogram. This thing, what do you call it? Screen. You know, you use probes, right? Every student here should know what an echocardiogram is, right? So let me not waste my time. You insert the needle into the pericardial sac. You remove the fluid or the blood. Then, even if you are doing it for therapeutic purposes to relieve the patient, after doing it, you must send that fluid for histology or chemical pathology. You must send that fluid for chemical pathology so that they will know the composition of that fluid, so that it can be able to like, the results will help you know more of those conditions, right? Then potential placement of a drainage catheter. So if you know that the fluid will now be coming back, you can just place a catheter there so that it will always drain it up. Okay. You see, pericardial. Okay, I've explained this image. Types of pericardiocentesis. You are doing it under echo guidance, which is the most common one. You can also do it or fluoroscopy guided. You can do it under CT scan guided. Okay. Guidance. All right. Complications. Every surgery is every medical procedure is even if it's a minimal surgery. Of course, you are penetrating the person, you are invading the person. So there's potentials for bleeding, potentials for what? Infections, potentials for heart injury. You could pass through the fluid, injure the person's heart if you're not careful, right? Then it could lead to what? Pneumothorax. As you're extracting the fluid, there's a wound, air could go through the wound, then start gathering in the thoracic cavity. Then it could lead to cardiac arrhythmias, right? Benefits. If you are doing this type of surgery is to like remove the fluid, so now you are relieving the patient of cardiac tamponade, you are improving their what? Cardiac function, you are reducing the risk of what? Complications. From there, you can be able to get some amount of the fluid for analysis, all right? The potential avoidance of what? Some other complex surgeries, all right? You're trying to treat it early enough, right? So from here, this is just what post-procedure care, like things you be doing to the patient after the surgery and all that, right? So I think that's it for pericardiocentesis medical procedure, indications, types, complications, and the rest.